All right, we are going live. Excited to be here. I know this is a different time than usual, a different day, but thank you for being here and joining us. So, we have a guest speaker. We have Dr. Edwin, who is a pharmacist.
Hi, everyone. See everybody again.
All right. Yes, he's talked to us about diabetes meds, and this time we're doing medications on high blood pressure. So I'm going to let Dr. Edwin kind of talk about the basics, and then he'll start talking about the basics about the different types of blood pressure medicine, the different classes. I think it's good for you to know your choices, that there's definitely more than one choice. Okay. All right
Right.
ahead.
So thank you, Dr. Legas.
Yes.
So for many of you, you may have concerns, questions about where your blood pressure should be, where should it be at, and really, it's a discussion that can be entertained by a pharmacist and a physician, of course. And for the general population out there, it should be 130 over 80. Many of you do measure your blood pressure at home and do get some readings in the morning, right? So if you do, you want to make sure you talk to your doctor about when's the best time, of course. And there are other conditions where your blood pressure may be a little bit more restricted or a little bit more relaxed, depending on your other medical conditions that you may or may not have. So, in general, for those of you that don't really understand blood pressure or have some confusion surrounding it, I'm going to go ahead and just show you really quickly what the American Heart Association, which is what physicians use across the country, use as a basis for categorizing a patient for hypertension.
Right.
So,
Okay.
let me use the left foot here. I think that should be good.
Mm-hmm.
Okay.
I'll adjust it.
Thank you. So for the general population, as I mentioned, should be typically on average, say your blood pressure should be less than 130 over 80. Okay.
Mm-hmm.
Um, now let's say you don't have high blood pressure, right? And you're like, well, why is this a concern for me? It's because it's important to know more or less where you stand and should you be reassessed? Should you go to your doctor and get more checkups more frequently, right? And so the American Heart Association has put out guidelines to sort of understand where the patient should be at. So, for example, if a patient has, let's say, a blood pressure of 120 to 129, and their diastolic, which is their blood pressure when the heart is filling up with blood,
Yes. That's
which is
good.
the bottom number you usually read.
Mhm.
This indicates that your blood pressure may be elevated. It's my handwriting. Okay. And so typically this can be caused by, stress, some foods and drinks that people consume. So it's important to know that, the things that we put in our body are going to affect these numbers, right? And so moving on to the next stage here, 130 to 139,
Mhm.
or a diastolic of
80 to 90.
80
80 to 89.
to 89, we would classify you technically
That's high blood pressure, stage one.
stage
That's
one.
stage one.
Stage one, exactly.
Mm-hmm.
So a systolic blood pressure, the blood
Top
pressure,
number.
you're right, when the blood is being pumped out to the circulatory system out from your heart,
Mm-hmm.
or a diastolic of 80 to 89 would indicate a stage one. Okay.
Right.
And so this would be some concern for a lot of folks, okay, for many of you. And so there is another category here where unfortunately the systolic blood pressure, right, is above greater than 140,
Or 90,
right, or
greater than 90.
90,
Bottom number higher than 90.
right,
Stage 2. There you go.
right there.
Mm-hmm.
Okay. So at this point, your physician would assess where you stand. They would essentially calculate what other comorbidities or other medical conditions
Right.
um,
Mm-hmm.
play a factor into your blood pressure. And then from there, potentially prescribe medications for you. So I'm going to go over
Very
some of
cool.
the medications.
Okay.
Dr. Legans, you want to
Yeah.
add something to that?
No, I would just say that this is a very nice, simplistic approach. I've seen some that are much more complicated than this, but basically 120 over 80 is our typically that's what we like. Okay. Anything under 130 is also pretty good. We call that controlled blood pressure. If it's under 130 on the top and under 90 on the bottom. Um, this right here, this number, when it gets to 140 over 90, this is where we start looking at giving people medications when it consistently the top numbers over 140 or the bottom number is over 90. We start talking about let's put you on maybe one medication, and keep following up. Or if you decide no, I don't want to do medications, when we say okay, um, eat right, lose a little weight, stop smoking, stop drinking, make some changes in your life, and then come back and we'll recheck it. And we just keep rechecking it and keep talking about ways to get that blood pressure down.
Absolutely. And this is because um, high blood pressure can be managed very well, but it is something that does take time because it
Mhm.
takes a very, very long time for it to develop. This is why in America we call it the quote unquote silent killer,
Silent killer.
right? Because it takes 10 plus years for it to develop. And for most patients, they're not really symptomatic,
Hmm.
meaning they don't present with symptoms. You just something that occurs. And um, several years back, the number one prescribed drug in America was a drug that you folks may recall and recognize as lisinopril.
Mm.
Okay,
Oh.
and that falls into one class of medications, and it just shows, I guess, more or less, unfortunately, the health of this country, right?
Wow.
And so,
Wow.
right. So
Okay.
I'll be going over some of the medications for y'all, and for some of you that may fall in these categories or may have been prescribed some medications, you guys may have heard of. There's a class called ACE inhibitors, and this class has a few examples. What many of you have been prescribed, for example, lisinopril,
Very popular one.
right? Maybe a low dose
Hmm.
lisinopril, um, or enalapril,
Hmm. Benazepril.
right?
Another
Benazepril is
one.
another one,
Enzapril.
right? So that's really the suffix that you know that this is a class of medications,
Right.
and this would be the first line for the general population out there to bring
Hmm.
down your blood pressure
For most people.
for most people, right?
Hmm.
There is another a similar class. We call these the ARBs, and so there's the
Yes.
yeah. An example would be
Balsam.
valsartan. Okay,
Uh-huh. Losartan is another
valsartan.
one. Or Cozar, I think is the brand name for that.
Right.
Losartan, aka Cozar. Let me ask you this. Can
Sure.
you briefly explain what ACE stands for?
ACE stands for angiotensin converting enzyme.
Mm.
So this is a drug basically that inhibits this enzyme. This enzyme, angiotensin converting enzyme, converts a molecule that's very important in the synthesis and producing that blood pressure
Mm.
that affects the kidneys.
Mm.
And typically, this is prescribed to help preserve
Mm.
now this is kind of a more medical jargon here, to preserve renal function,
Kidney function.
kidney function. For
Mhm.
those of you that may recall in our last video, CKD, right? Chronic
Mhm.
kidney disease,
Mhm.
especially for our diabetics, right? Because it shows that um, these inhibitors, this class of medications, helps preserve that renal function,
Mhm.
and it's a slow decline because um, one of the top uh, I guess you would say complications of diabetes is nephropathy, right?
Kidney
Chronic kidney
disease.
disease, right?
People having to get on dialysis, sometimes that's from the
Mhm.
blood pressure. Now, there is an exception. Can you explain the exception to that particular rule as far as that being the best medicine? And that is in Black folks,
Right.
right?
So these medications work differently for every individual,
Mhm.
and depending on the set of genes that you have inherited, these drugs may work differently. And it's something in pharmacy that we call pharmacokinetics and pharmacodynamics. The way the drug is metabolized, the way the drug interacts with the body, and how the body interacts with the drug.
Mhm.
So, one of the exceptions that Dr. Legans was talking about is that ACE inhibitors may produce a pronounced effect, may increase your risk for the African American population of angioedema, which is the swelling of your arteries. Okay, and so the swelling of the face, nose, jaw, throat, and so typically it is a higher percentage of this population that has that pronounced side effect. So this is why um, if you do have signs and symptoms of that, typically they would be switched to an ARB.
Mhm.
So if you are for the African American population are on any of these lisinopril, enalapril, benazepril, and you do present with those um, with those symptoms, or you can't tolerate, for example, dry cough,
Yes, I
you
was
would
just
switch,
yep.
right? For a lot of folks, you have a dry hacking cough, which is another side effect of ACE inhibitors, which
Mhm.
I'll get into the side effects just in a bit.
Mhm.
Um, you would either switch to an ARB or lower the dose, but a lot of folks, physicians, they tend to switch to an
Switch.
ARB,
Yeah.
and it's gone like that.
Yep.
Okay, so
Works.
losartan, for example,
Mhm.
and so
Good.
it's just one of those things where to look out for, and I've counseled some patients on making that switch too.
Now, what does ARB stand for?
ARB stands for angiotensin
Mhm.
receptor blocker.
Right.
So this molecule, the ARB, sits on the receptor before one of a molecule that is in that pathway binds to this binds to this receptor.
Mhm.
So if you block that molecule,
Mhm.
basically you stop the floodgates from opening, and these floodgates have downstream effects, which in turn rise your blood pressure.
That's good. That's right. That's good. And I would say this also helps protect the kidney as well.
Absolutely, absolutely.
It's
There's hard evidence for it. I mean, it's in the American Heart Association guidelines, ACC guidelines. So
it's a good one.
absolutely, yeah,
Both of these are pretty good, but lately we've been a little bit more on this one because of the irritating dry cough that some of these can cause. But sometimes when people are already on the medicine, if it's not causing a cough, it's not causing side effects, we'll go ahead and keep people on that medicine. If it's not broke, we just don't fix it, right? So we
there you
just,
go.
but it's just good to be aware because sometimes you're busy and you start developing a cough. Well, you could kind of like, if you figure out I'm on this medicine, well, maybe if I just go ahead and pause the medicine for a couple of days and see if the cough gets better, well, then you know what the cause is. Go make an appointment, see a doctor, and ask for this class
Absolutely.
or
And
another
so
class.
there are more classes, obviously, like Dr. Lugan said, hypertension stage 2. Your physician may prescribe you another medication because the physician really wants to keep that blood pressure down,
Mhm,
um, because due to the fact that it's really high. And so there is a class called the thiazides,
mhm.
Okay. So typically your doctor would prescribe you something like, for example, and this is a long name for a lot of patients that I see.
We
No,
just
for
say
real.
HCTZ for short.
HCTC.
It's
So
too long. It says a hydrochlorothiazide,
absolutely.
but HCTZ is what we all tend to call it. HCT or HCTZ.
Right. And so this is another medication that can also be used in conjunction with, for example, if you're having that dry cough, then you can also be switched to this class potentially. But usually you see, like Dr. Gon said, an ARB. So you'll see some of these thiazides, for example, hydrochlorothiazide, and another
Chlorothalidone.
chlorothalidone being
Mm-hmm.
prescribed in combination with lisinopril.
Mm-hmm.
Okay, so
Right.
like your Hyzar, for example.
A
And so,
lot of them actually may see combo pills of like the lisinopril HCT or like the losartan HCT. They're already in the combination pill. So some of you may already be on combination pills
right.
even now.
And so one of the side effects of being on a thiazide here is that it may it's gonna make you go pee. So you may
It's a diuretic.
yeah, it's a diuretic.
It's a
So
water pill, as
it's
some
a
of you
water pill.
know.
But also one of the things that I've seen, especially out here, um, in the low desert is something called photosensitivity. So your body may be more sensitive to light and your sun exposure,
Mhm.
just more increased risk of like sunburn, for example.
Oh, okay. I didn't even know that.
Long-term use, really.
Okay.
It does take some time for it to develop,
Hmm.
and it may increase the your sugars just a little bit.
Mhm.
Um, but it is a diuretic. It is a water pill. So this is why typically when it's prescribed, it's usually you should take it at night. That's my recommendation, really, okay, as a pharmacist. So,
Take
um,
which one at night? This one?
I'm sorry, in the morning,
In the
in the
morning. Yeah.
thiazides. Yeah,
Because it makes you
take it
go
at night.
pee, so we tell you
Yeah,
take it in the morning time.
yeah, because
Okay.
otherwise you'll be waking up at night to
We
go
don't
pee.
want to disrupt your sleep.
Absolutely. And insomnia, the lack of sleep, also causes high blood pressure long term.
Mhm.
Okay,
Yes,
for
it
all those
does.
insomniacs out there.
Yes, it does. Keep that
Absolutely.
in mind. Okay.
So, just keeping time here. We do have another class of medications called
CCB.
CCB, so calcium channel blockers.
Mm-hmm.
Okay, so this is a really good one for those out there
Mm-hmm.
that have like heart failure, for example, or that are for the patient for the pregnant patient population.
Mm-hmm.
So you typically see something like amlodipine
Mm-hmm.
being prescribed,
Or nifedipine.
or nifedipine, which is another one prescribed for our pregnant populations. Okay.
Mm-hmm.
And so one of the side effects is that there's a potential for headaches.
Mm-hmm.
Okay.
Swelling.
Right. We call it swelling, bilateral edema.
Mm-hmm.
And so
Most of the
potentially,
time it's in the legs or the feet, but it
right.
could be anywhere.
And maybe some overgrowth of the gingiva. We call it
Oh, ginger.
gingival hyperplasia,
Yeah.
right? And so that's just something to look out for. So if you do, you want to consult your doctor and potentially get it switched
Mm-hmm.
to something else or lower the dose.
Mm-hmm.
Um, and let's say you're already on a medication and your blood pressure is not being controlled. There is another class here, and I'll go a little bit more quickly. These are your alpha 2 agonists, which you would call essentially, for example,
Clonidine.
clonidine. Okay, so clonidine is actually a more potent antihypertensive than the rest of these
It
because
works very fast
it
too.
works very fast and it
Mhm.
acts on the alpha receptors. So it really vasodilates your systemic arteries to a larger extent, which is why usually clonidine you usually see it prescribed typically after you've been on a combination of these.
It's not our first line. It's not one of the ones we start using right away. However, if you go to the doctor and your blood pressure is high, typically we would give a clonidine dose to you. We'll offer clonidine because it works well and it works fast. So that's you may be familiar with it and you may have already taken it if you go to the even emergency rooms or but mostly in the outpatient doctor's offices. We use that quite a bit. Another place you may see this is some children take this medicine. And I had a patient look it up, and she was like,
Yeah.
"This is for ADD. I don't want to take this medicine." I had given it to her for, I think, anxiety. We also give it for anxiety. Sometimes we may give it to help someone to sleep. But typically, it's used for children with hyperactivity to help them to sleep at night.
Right. And that's one of the side effects also from clonidine is that may cause
Drowsiness.
that drowsiness. Yeah, right. The
Mhm.
sedation
Mhm.
and dry mouth, of course. Um, so
It's one of those. I just want to say one
yeah,
more thing about clonidine. Clonidine is one of those kind of drugs that we could use for several different things. We even sometimes use it to help people who are dealing with either PMS or menopause symptoms. It sometimes helps the menopause symptoms. It helps when people are coming off of alcohol. We sometimes give it to help with the withdrawal symptoms, either alcohol or some drugs that causes irritability. Clonidine helps with that. Okay,
absolutely.
so sorry
So
about that.
no worries, no worries. So we've talked about medications, right? And so the idea is for a patient to use these medications to help bring down the blood pressure. But there are other approaches, right? This is just one piece of the pie that we approach, right, using drugs. But there are lifestyle changes, we call modifications, to help bring down the blood pressure, right? Because, like I said earlier, what you eat, what you put in your body is very important. Physical activity is very important to bring it down. I'm sure most of you kind of understand that. And I just want to break down really quickly something that has evidence-based practice, right?
Mhm.
So something proposed and shown to bring down the blood pressure is something called the DASH diet. Okay, so I think I have space
You
here.
could do it over here if you want. I'll just move it.
Okay.
There we
DASH
go.
diet. So what is the DASH diet? Does anybody know? All right, good. So DASH diet essentially stands for dietary dietary approaches to stop hypertension, right? DASH.
That's what it stands for.
So the American Heart Association has put out what you should be eating, what you should be doing, what kind of physical activity. And so what you want to do is have a diet rich in fruits and veggies, right? So leafy greens. Okay, you want to have fruits that are rich in potassium, for example,
Mhm.
magnesium. So making
Mhm.
sure you have your pecans, almonds, walnuts.
Mhm.
Okay. Um,
Dark chocolate has magnesium too.
right.
Mhm.
And if it can be like the cocoa, like the non-sugary, even
Mhm.
better. So calcium is another one. Ensuring that you want to get your goal is to get at least 150 minutes
Cardio,
yeah, cardio per week. Okay.
exercise.
So you can do, for example, 30 minutes of just jogging, some sort of aerobic activity, something to
Mhm.
get your heart going, something to
Mhm.
get you sweating. 30
Mhm.
minutes a day, 5 times a week. That if you can start at maybe 2 days a week, one
Mhm.
day a week, and then slowly, gradually build your way up. Okay.
You can even start at 10 minutes 2 times a day or 5 minutes 2 times. Start where you are, but keep doing it till your body gets used to it.
Right, right. And so another big thing, another leading cause of hypertension, long-standing hypertension, is decrease your salt intake.
So that's a big one.
So
Especially in the, I have to
mhm,
since I'm Black, okay, so I gonna represent the Black folks.
sure.
Especially in Black folks, this right here, bringing that sodium level down has been proven to we're more sensitive to salt than other races, I guess you could say, or
Mhm.
ethnicities. We're more our systems are much more sensitive to salt. So if we could decrease that salt intake, typically the blood pressure responds very well. The other thing I'd like to mention is the thiazides typically also bring the sodium levels down, and thiazides work really well in Black folks, and so does the CCBs, amlodipine. I remember one time I had a patient, and we were giving her all these other medicines, and finally she said, "Oh, my mother takes amlodipine." We put her amlodipine, and what? Voila! Blood pressure came right down. It just really responded well. So, that just goes to show you I should have had it on that in the first place, but this was years ago. You live and learn. But anyways, yeah, so this is it's true. It really is true. There's two classes that seem to work very well in the African American or AKA Black population.
Absolutely, yeah, and those two have hard evidence for it to be shown. And so, yeah, you want to reduce down your salt intake less than 2 grams a day, 2.4. But really, the lower the better. Okay,
Mhm.
not to get too technical, and really, the exercise is a really big thing. So, using these approaches will help in conjunction with the medications to bring down the blood pressure slowly. And the more gradual and the more consistency that one can build, the more feasible these goals can be met, right?
Yes,
And so,
it's true.
with that, um,
It's good.
anything else you want to add, Doctor?
There's a lot of times we forget about two things that people can also do or not do, I should say,
Mhm.
to bring down their blood pressure. And one is drinking alcohol, and the other one is smoking cigarettes.
Absolutely, yeah.
Mhm.
There's so much more. I mean, those two, even just stop smoking, just will
That's a
drastically,
big one.
yeah.
That is a big one. Let me tell you, I'll never forget, I had an older gentleman. He was not obese. Okay. So it wasn't, he was not African American. African Americans tend to have a hard time bringing the blood pressure down too, but he was Mexican American and he smoked cigarettes. And I don't even think it was a lot of cigarettes, but he smoked on a daily basis. He also had diabetes, but his blood pressure used to always be high. And we had him on 3, 4 medications trying to control that blood pressure. He unfortunately had to bury his son due to diabetes. But after that, he decided to quit smoking.
Wow.
And he quit smoking, and do you know I immediately had to take him off 2 medications right off the bat because his blood pressure was dropping too low because he quit smoking. So that's just how dramatic the difference can be from when someone smokes. I was kind of shocked how his blood pressure dropped so radically. It was like, whoa, 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 let's bring down let's take you off some of these blood pressure medicines. And we
Right.
had to do that right away. So, and I've seen that in other people where they made some changing in their lifestyles. This one, there was recently a patient, they weren't even a smoker, but they decided to do this dash, make some serious changes in their fruits and vegetables, started exercising more, watching their salt intake, their portion sizes, and I had to start scaling back their medications so that because they were dropping too low.
Right.
And so that's a good thing.
It's wow, that's such an amazing story there, and it
Yeah,
just goes to show like how just don't smoke. If you feel like you cannot reach out to your provider, reach
yeah,
out to your pharmacist.
yeah,
We're always there to help.
yeah.
And so, yeah, just making sure that you have a good support group because um, these measures will help bring down blood pressure, and you know, once it's more controlled, then yes, we can start kind of taking a step back on pulling back on some of these medications here.
This is good.
Yeah.
This is very good. This is all very important. Another one that we forget is stress. Stress is a major killer, but when we eat healthier, I kid you not, when people actually start to eat healthier, it does kinda help their emotions. Exercise is another way to help get the stress off of your mind and your body. Being like he said about sleep making sure that you try your best to, focus on getting good sleep and good rest. Again, these are things to talk to your primary care doctor about, or you could even talk to your mental health counselor,
Absolutely.
because nowadays people are reaching out and getting mental health counseling, therapy. We know we need it, right? We're all so stressed, but yeah, getting your mental health. Don't forget about your mental health and take care of yourself mentally as well. But yeah, I think this was good. And then you guys can always put comments in the chat, and I'll review those at a different time. But for right now, we're going to call it a day. We try to keep our conversations to 30 minutes or less because I know we're all busy people.
Absolutely. And I mean, any questions or concerns, feel free to reach out, obviously, right, to your primary care provider, but
Mhm.
also to us,
Yep.
or in the comment section, I
Yep.
believe, right?
Right. Uh-huh.
Um,
In the
we're,
comments.
open to answering all your questions, concerns, and I think that that's something important because,
Yeah.
yeah, I think the more education one can get, and the more involved the patient can get in their own ailment, as I mentioned in the previous video, the more feasible, right, we can attain these goals.
Because it
Uh,
takes two to
Tango, but it really takes a village, as I believe.
takes a
So
village. It does take a
yeah,
village. Yeah. Thank you. All right. Well, I guess we'll call it a day. Thank you, everyone, for joining us. And until next time, I guess we may be doing one on heart failure in a week or two, maybe.
absolutely.
Does that
Yeah,
sound good?
yes, absolutely.
Heart failure is a big one out there. So we'll be
Yeah,
tackling
big topic.
those medicines one day. Thank you so much, Dr.
All right,
Edwin,
thank you,
for
doctor.
showing up.
Bye, guys.
Bye, everybody. All right. Girl, here we go. There we go. Awesome.
All right.